Alright. Hello everyone. So this video is going to be about the non-pharmacological treatment of cough. So before we go into this video, we want to know what cough is. So basically, we must have heard of the word cough, or we must have seen someone experience it, or we ourselves must have experienced it. So in the health world, cough is defined as a defensive mechanism or a protective reflex used by your body to remove irritants or foreign particles from your body. That's in the sense that it occurs when your body wants to remove dirt or dust from your respiratory tract, that's your lungs or your throat. So based on this definition, now cough can occur in two scenarios or conditions, and it can be physiological or pathological. So physiological in the sense that if someone is healthy and strong and is in a room filled with smoke, probably due to cooking or fire hazard, the person has a very high tendency to cough. While in the pathological scenario, it's in the sense the person is actually sick, and this is the one that we must be used to, that we all are used to. So now, pathologically now, cough can be treated, right? So we said, like I said earlier, this video is about the non-pharmacological one. So pharmacologically, it can be treated. That's when you actually administer these orthodox medicines, that's the drugs we all know. But this video will focus mainly on the non-pharmacological ways. And this mechanism used by these non-pharmacological ways can be automatic inhibition of the cough, or reduction of heightened sensitivity to the cough receptors, or reduction of your laryngeal sensitivity. That's laryngeal sensitivities in the sense that reduction of the tendency of your respiratory tract or your throat to respond to particles. So the therapies used by these non-pharmacological methods are actually much, and we wanted to learn more about them. So the therapies include you have your physiotherapy, we have your complementary therapy, we have your self-education, and we have your aromatherapy, and definitely behavioral approaches. That's the way you behave if you are sick. So going further into these videos, my colleagues and my fellow mates will actually explain these therapies better for you, and we actually hope you enjoy this video.
On complementary therapies, these therapies are used alongside conventional treatment to manage cough symptoms. And some of these complementary therapies include humidified air, whereby humidifiers are used indoors to increase the humidity activity, making the airway moist, reducing cough irritations, and reducing cough symptoms. Another can be seen in acupuncture. This is where thin needles are used on vital points in the body to restore balance and alleviate symptoms. Aromatherapy. I know that many of us have heard of this. So this includes the use of volatile oils such as eucalyptus oil, peppermint, and lavender. And this inhalation can be done through steam or use of diffusers. Breathing techniques. Some breathing techniques such as yoga have helped to improve lung function and reduce stress. Halotherapy, also known as salt therapy, whereby salt particles are exposed to air to reduce inflammation, reduce mucus buildup, and reduce cough.
I'm going to take you guys on the patient's education. Educating the patient plays a crucial role in the non-pharmacological therapy of cough. The first one I'm going to talk about is understanding the underlying cause of the cough. Understanding the underlying cause of the cough is by educating the patient on the problem, the reason for their cough, such as respiratory infections, the allergies, asthmas, which help in tailoring the management strategies. The second one I'm going to talk about is the proper breathing techniques. We have different proper breathing techniques a patient can undergo, which is the deep breathing, diaphragmatic breathing, and the controlled breathing, which can help to optimize the lung function and to reduce breathlessness. We can also tell the patient about the airway clearance techniques. We have different airway clearance techniques, such as the huffing, the coughing, the chest physiotherapy, and the fluter waves, which helps to clear mucus, and a management strategies in cough. Hydration and nutrition. Emphasizing on the patient being hydrated and taking a balanced diet is necessary for a healthy life and to reduce cough triggers. You can also say exercise and physical activity. educating the patient on taking exercise to have overall fitness and to manage cough. Exercises such as the yoga, the touching.
Prior to what my colleague said, I'll be speaking on behavioral approaches. Behavioral approaches offer a non-pharmacological method to treat and manage chronic cough. It involves practicing habit modification, environmental factors, conditioning, and then trigger avoidance. There are many ways that behavioral approaches could work in our life. I will list out 3. Number 1, cognitive behavioral therapy. It involves educating the patient on challenging negative thought patterns so as to combat those psychological factors that cause or triggers cough. Number 2, habit reversal training. It involves identifying those habits or sensations or even situations that leads to cough and then complementing them with alternate behavior, such as if you feel the urge to cough, you can take a sip of water or control breathing. You can control your breathing. Number 3, trigger identification and avoidance. It simply means identifying those triggers, which could be environmental triggers or behavioral triggers. General triggers could be dust, smoke, pollutants, or even strong odor. It can also be in form of food materials. Some people might take peas or nuts, which could trigger the urge to cough. So I prefer you should check out your preference on those things and then avoid what needs to be avoided.
I'll be speaking on self-medication, an aspect under the non-pharmacological approaches to treatment of cough. Now, we all know from the name self-medication, it implies those approaches used by individuals such as you and I to cough and alleviate the symptoms of cough. Now, the first approach under self-medication is the use of soft water gargles. And soft water gargles help to alleviate the symptoms by soothing the throat. And also, another approach used is rest. We need adequate rest for us to alleviate the symptoms and hereby prevent coughing. Now, another mechanism is the use of honey. Honey, as you know, is a natural remedy for this treatment of cough. It is widespread in our society, but it is actually contraindicated in children below the age of 1 year old. Now, another approach to use is actually the use of humidifiers. Now, putting on humidifiers helps add moisture to the environment and avoid the presence of irritants such as smoke and all the rest of them. Now, another approach which I'll be discussing is on the aspect of taking in enough fluids. It's very, very important that as humans we take in enough water in order to alleviate the symptoms and reduce cough.
One may think that all these non-pharmacological ways of managing cough may not have precautions, but here are some of the precautions one ought to take. Number 1, having a healthcare provider. Patients who may be having underlying issues such as COPD, asthma may need a healthcare provider on ways to manage this cough. Number 2 is allergies. Some allergens found in ingredients such as honey used in the remedy of cough may contain allergies which can incite cough. Age consideration. Children under the age of 1 are in the risk of botulism as a result of taking intake of honey. Monitoring. This is as a result of being consistent in the monitoring, keeping track records, and if these non-pharmacological ways are worsening these issues, then one should withdraw from such. Personal hygiene. What are these hygienes? Most people that makes use of the humidifier may be at the risk of the growth of mold and bacteria, which can increase or worsen respiratory infection.
As you all have heard, non-pharmacological therapy is good and essential because it reduces cough frequency and improves the quality of life. Non-pharmacological therapy is nice in such a way that it has no apparent adverse effects compared to pharmacological therapy. Thank you for watching. See you next time.